The hero, who paints his performance with popular fun, enjoys his work, tries to build his life on positive notes, stays out of dealing with the difficulties he considers temporary.
I saw that there were small black dots under his feet, like gangrene.
Once, a long, painful struggle with an unknown end began.
It was a very difficult situation, and it was really hard for us to tell the prognosis.
There was not a trace of spiritual magnificence that was at the beginning of the journey.
I had completely lost all of my hopes. I'm saying it once more. If it hadn't been Mrs. Arzu, my legs would have been amputated.
Once I saw his legs completely reddened, I realized that it was from sugar. I told him to get up and go to the doctor, but he refused. He sprained his feet. The next day, I saw that there were black dots under his feet. I thought it was gangrene. We needed to go to the doctor, so we did. After the examination, the surgeon said that legs need to be amputated.
Then I had a shock that my legs could be amputated. He said that the wound was festered. We left the room. We got the Dr. Arzu's phone number. We intended to visit her before, but I didn't know her at that time. My son took us there. We arrived at the hospital at around 3 o'clock, and she works until 4 o'clock. We sat down and talked to her. She examined my leg. She said that I was too late, but then she promised to do whatever she can.
The patient complaints were associated with aching, burning pain in the lower limbs, difficulty in walking, non-healing trophic ulcers, general weakness, fatigue in the lower extremities, impaired sensitivity, as well as high blood pressure and a recent decrease in blood sugar level.
I started to take treatment with her.
Diagnosis revealed the patient's high blood glucose, increased glycohemoglobin and blood pressure reaching 220 to 120, and the severe of the matter was alarming. It made us quite worried. Besides, determined transfer of sensitivity and function, weakening of the distal, the formation of a diabetic foot in the foot area and under the foot was initially visible upon the diagnosis of the legs.
A persistent high blood glucose cycle is characteristic for diabetes. If this continues for a long time, the metabolism in the blood and intravascular lymphs and the balance of its structural elements are disturbed in the medium matrix of cells by the processes of the non-enzymatic process of glucolysin. The ion exchange of the matrix and the filtering function are exhausted, which makes it difficult to protect cells from toxic substances. This gradually leads to a complete loss of the characteristics of regulation, nervous patency, and impaired sensitivity. This moment ultimately confronts patients with severe complications created by diabetes in the lower extremities, trophic ulcers, gangrenes, diabetic foot syndrome, and finally amputation. It should be noted that 80–85% of the lower limb amputations performed in the world were on diabetes patients.
The body is so loaded that external toxins, the endotoxins of the food, and the disease itself, as well as contraindications to the medication taken, are collected in the body and create a contaminated environment. Previously taken drugs are no longer effective.
I almost visited everywhere in Baku in Azerbaijan. I was examined by the Turkish doctors as well as by our local doctors, also by the young and the elderly ones. There are many surgeons. They stop the wound. However, the internal process cannot be stopped. They prevented when it emerged but couldn't find its source.
It is during this period that you need to apply to the bioregulatory therapy. The treatments carried out based on these methods to eliminate resistance against the medication, and injected insulin and the body begins to respond to the treatment.
My problem was found in Bioloji clinic. I do not condemn other doctors, they just didn't know about much. But in Bioloji, they found my problem.
Are you feeling anything?
Yes.
Primary treatment should specifically be directed at detoxifying the body. To this end, we further add homeopuncture to treatment in order to improve blood circulation in the lower extremities, and also for the purpose of carrying out medical work in the nervous supply, we carry out neural therapies. All these treatments are carried out using general ozone therapy and ozone boots.
I noticed that the pain and the gripes in my legs and vessels have stopped. And every day my body was getting better.
As a result, necrobiotic and festering of both feet has stopped. On one leg, wounds healed without any amputation. And in another area under the foot, the same healing process of a trophic ulcer occurred.
Thanks to God that the process has stopped in my leg. Every time when my spouse uncovered the wound and wanted to clear my food, she was seeing that the food became darker, so we were rushing to the doctor. The surgeon was clearing and we were going back. But now the process has stopped.
Today, the patient visits the clinic for the second time for treatment. When he was released from the hospital, the patient was advised to revisit the clinic every 6 months for preventive treatment.
Finally, the fight was over in victory. Now its severity is nothing but memory.
I used to get off the car and go to the doctor in a wheelchair. Now, thanks to God, that I even go to my work. Long live the doctor. Thank you. Thank you very much.
But the calmness of today does not let to forget the lesson given by this memory.
Now I know that what does the health mean. I do not wish the pain and the gripes which I had, even to my enemy. I was about to die.
A person only needs health in this life.